Good afternoon, good evening. Hey, Sammy. So everybody, this is Nurse Eunice, and tonight's video is our Sunday Night Live. And today we have our members only. So if you're a member of Scrub Buddies or Scrubs to Ambition, we're happy to have you here. I see Sammy in the chat. I see Solano. And so we'll give a few more seconds for others to attend and join. But if not, we're going to go ahead and get started. And then, Sammy, if you ever want to join me live on screen and you have your camera on, just go ahead and send me your email address, and then I can send you an invitation. So we'll get started soon. So many of you all have already supported us by purchasing our vital signs bundle. So yes, I know how hard it is to learn vital signs, to understand, what you're listening for, to understand all those numbers. And some of you all will ask, well, is this going to be on my test? And I want to remind you that after you pass your test, you have to take care of people and you have to do vital signs. So you have to, it's a requirement that you understand what you're doing so that we can keep our patients safe. And so if you want flow charts, if you want a deep dive into vital signs, go ahead. You can use that QR code that's on the screen, or there's a domain. There's my website that's scrolling along the bottom, nurseeunice.com. You're welcome to go to that also. And you asked and I listened. You all wanted all of my skills videos together. So yes, the skills videos are on either of my channels. It could be on Florida Training and also on Eunice Mathis. But that's going to help you not just pass your skills test, but to understand the reason why we have you do things a certain way. And it's going to teach you that medical terminology. So Sammy and Solano, let's get ready for our test. All right, and this one says question 26. The reason why we're starting off with 26 is because we did the last 25 last week. And so we're starting this week afresh with part 2. This one is not just focused on tube feeding. This one is more focused on diet and nutrition. So when you're taking care of those patients and they have certain conditions, those conditions will necessitate dietary changes. And that's what we're going to be discussing today. So that not only will you pass your test, you will be a better caregiver. So let's go. Question number 26. A patient with difficulty swallowing or dysphagia is at risk for choking. Which diet type is most appropriate? Is it A, a regular diet, B, a pureed diet, C, a mechanical soft diet, or D, a high fiber diet? And we'll give you a few moments to put your answers in the chat. I'm so proud of you. I see some of you all saying that you passed your exam. So congratulations. And yes, you have it. So if they're having difficulty swallowing, I see you're torn between B's and C's. If they're having difficulty swallowing and they're at risk of choking, we're not going to give them anything that they would have to bite. So it would not be C, mechanical soft. The answer is going to be B, pureed diet. And here's the rationale. A pureed diet reduces the risk of aspiration and choking by making food easier to swallow for patients with dysphagia. CNA should also ensure the patient is upright during the meals. In that upright position, we call that Fowler's. And there are 2 different types of Fowler's. There's semi and high. When you're feeding someone, try to sit them up as close to 90 degrees as possible. It may not be comfortable for them, but you can make it comfortable by adjusting pillows, sitting them upright. And then once you're done feeding them, you can lay them back into the semi-Fowler's position. But notice I didn't say lay them down, because we have to give their food time to digest. So they can't be flat for about 30 to 45 minutes. Let's go to question number 27. What type of diet is recommended for patients with diabetes? Is it A, a low protein, high fat diet, B, high sugar diet, C, low glycemic, balanced carbohydrate diet, or D, all liquid diet? And I'm so happy to have our members here. Hello, everybody. Start putting those answers in the chat for me. Great job. You have it. The answer is C. Low glycemic, balanced carbohydrate diet. Rationale. Controlling carbohydrate intake and focusing on low glycemic foods and also maintaining balance helps to regulate the blood sugar levels. And here's some more information. Low glycemic refers to foods that have a minimum impact on blood sugar levels after being consumed. So if you give someone a whole bunch of carbohydrates, of course they're going to spike the blood sugars. But if you give them something that has protein, usually that's going to level out and it won't cause as many spikes. That's why your diabetics, maybe they'll have salads, some lean meats, but we're going to try to stay away from the starchy foods, the mashed potatoes, the macaroni and cheese, all of those things that can cause the blood sugar to spike, and thus they have a high glycemic. Those would be high glycemic foods. Question 28. Which food should a patient with chronic kidney disease or CKD limit? Is it A, bananas, B, rice, C, bread, or D, chicken? Oh, this one's a little bit tricky. So if you don't have pen and paper yet, feel free to take notes. I need for you to learn this because you're going to be assigned 10 to 15 patients at some of your facilities, and these patients are going to have different nutritional needs. And so if somebody has renal failure or chronic kidney disease, that's right. They cannot have bananas because bananas are high in potassium. And so whenever the kidneys don't work, they can't excrete the potassium. And that can be dangerous for these patients because if the potassium levels become too high, they can go into cardiac arrest. Question 29. A patient with celiac disease must avoid, is it A, dairy products, B, fresh, fruits high in vitamin C, leafy green vegetables, or D, gluten-containing foods? Now, I'm going to be honest, when I was growing up, we didn't have some of these diseases. We didn't hear about celiac disease, but it's something that's real and it's something that can cause distress in your patient. So the answer for this one is going to be D. Whenever someone has celiac disease, they have to avoid foods containing gluten. And here's your rationale. Celiac disease is an autoimmune disorder where gluten triggers damage to the small intestine. CNA should watch for frequent diarrhea, bloating, gas, unexplained weight loss, fatigue, pale skin, and an itchy rash. Some patients may also experience mood changes and irritability. If a patient has celiac disease, CNA should ensure they receive a gluten-free diet, report any digestive issues or weight loss to the nurse, and be mindful of cross-contamination risk. So great job if you knew that one. Here's additional information. Feel free to take a picture of the slide, or you can always come back later and rewatch it. But foods that contain gluten would be pasta, noodles, breads, couscous, pastries, crackers, cereals, gravies, beer, etc. So think of things that may have yeast or things that have gone through some type of process, such as your breads and your pastas. Question 30. Which nutrient is most important for a patient recovering from surgery? Would it be A, carbohydrates, B, protein, C, fats, or D, sodium? Out of you, yes, you have it. It is B, protein. So protein is essential for tissue repair and wound healing post-surgery. Okay, question 31. A patient with iron deficiency anemia should be encouraged to eat which of the following? Is it A, citrus fruits, B, high sugar foods, C, processed snacks, or D, lean meats and leafy greens? I see we're torn, but the majority of you have D. Great job. All right, so lean meats and leafy greens. Those would be iron-rich foods that would help to replenish the iron stores and improve the red blood cell production. Question 32. What is the primary dietary concern for a patient with heart failure? Is it A, high fluid intake, B, high fluid and sodium intake, C, low sodium intake, or D, increased sugar intake? So someone has heart disease, their heart is failing. The heart pumps blood. So when the heart starts to fail, it's not circulating blood, and this person's arteries, veins, lungs can start to become congested. So, yes, we have to avoid B. That is so right. High fluid and sodium intake. Look, they cannot have a lot of fluids. They're going to be on a fluid restriction, especially if their legs look like this, and they're going to be on a low sodium diet because excessive fluid and sodium can cause fluid retention and worsen heart failure symptoms. All right, very proud of you. Let's go to the next one, team. Question 33. What diet modification is recommended for a patient with osteoporosis? Is it A, high calcium, vitamin D rich diet, B, low fat, low sodium diet, C, high protein, low calcium diet, or D, low fiber, high carbohydrate diet? When someone has osteoporosis, break those terms down. Okay, so osteo refers to the bone. Porosis is like spongy. So the bone is losing mass and is spongy. So what type of diet do you think is going to be best for somebody with bone issues? Absolutely, you have it right. Yes, the answer is A, high calcium, vitamin D rich diet. Calcium and vitamin D are essential for bone strength, and thus they help to prevent fractures. Question 34. A patient with diverticulitis should initially follow what type of diet? Break those terms down. It has itis at the end, so that's a suffix that would refer to inflammation. So even if you don't know what diverticulitis is, something is inflamed. All right, so a patient with inflammation should initially follow what type of diet? Would it be A, a high fiber diet, B, a keto diet, C, a high protein diet, or D, a low residue, low fiber diet? Fingers crossed. I think you're going to get this one right. I gave you a very good hint. And that is right. And you have it right. And you have it right. Great job. It is D. A low residue diet reduces strain on the digestive system, helping to prevent irritation during flare ups. So, patients with diverticulosis or diverticulitis should avoid low fiber processed foods, red and should probably say red meat, and processed meats, high fat or fried foods, carbonated drinks, and excessive alcohol, as these can lead to constipation and irritation. So some individuals may also need to limit nuts, seeds, and popcorn because they can get stuck, though research is mixed. Question 35. What diet is most appropriate for a patient with gallbladder disease? Is it A, high fiber diet, B, high sugar diet, C, a low fat diet, or D, high calcium diet? So this may require you to know what the gallbladder actually does. Okay, so if somebody has gallbladder disease, they're going to have to limit their fat. So the answer is C. So reducing fat intake minimizes gallbladder irritation and prevents bowel buildup. 36. Which nutrient should be restricted in a patient with liver disease? Would it be A, protein, B, carbohydrates, C, sugar, or D, sodium? And this one's more tricky than the other. So I want to see how many of you all can get this right. Patient has liver disease. So the liver could be inflamed. It can be enlarged. Hey, yeah, you're torn, but the answer is D. I'm so proud of you for even trying. So, and I know it looks like we skipped that slide. I do apologize. There it is. So the answer is D, sodium. High sodium can cause fluid retention and worsen liver disease complications. Remember, there's a term called hepatomegaly. So that's when the person has a liver that is larger than normal size. So we're not going to do anything to make that liver larger to cause that patient more pain. So thus, they're going to be on a low sodium diet also. 37. And I'm so proud of you. If you've been here this long, go ahead and give us a thumbs up. Don't forget to share our videos with a friend. And today's video is all about specialized diets and nutrition for your patients. So question 37. A patient with GERD or acid reflux should avoid which of the following? A, lean meats. B, spicy and acidic foods. C, whole grains. Or D, water. Absolutely. You are right. That's right. If they have acid reflux, we're not going to do anything to make their stomach more acidic. So we're going to do B. We're going to avoid spicy and acidic foods. These foods can increase acid production and worsen reflux symptoms. Sorry, my computer is doing something strange here, so just bear with me. Will you all see the answer? That was not what I was trying to do. All right, so here it is, question 38. A patient in the hospital setting begins choking on food, but is still forcefully coughing. As a CNA, what is the best initial action to take? A, immediately perform abdominal thrust, also known as the Heimlich maneuver. B, lay the patient flat and check their airway. C, encourage the patient to continue coughing and monitor closely. Or D, offer the patient water to help clear the obstruction. I know I had already shown you the answer, so of course it is C. You're going to encourage the patient to continue coughing and you will continue monitoring. Here's the rationale. If a choking patient is still forcefully coughing, it means their airway is partially obstructed but not fully blocked. Coughing is the body's natural defense to clear the airway, so it is best to encourage them to continue. Intervening too soon with abdominal thrust may force the object deeper into the airway. You should stay with the patient, monitor their breathing, and be prepared to act if the obstruction worsens. Don't forget to notify your nurse. Question 39. When assisting a resident in a nursing home, you notice that they were choking and now they've become unresponsive. What should you do after calling for help? A, perform a blind finger sweep to remove the obstruction. B, hit the patient in the back and wait for the nurse to give further instructions. C, attempt abdominal thrust while the patient is laying down. Or D, begin chest compressions immediately and check for the obstructions between, I think this is between breaths. I can't see on my slide. Right. Yes, it is D. So begin compressions immediately and check for the obstruction between sets. That means whenever you're done with your compressions and you would normally give breaths, instead of giving the breaths, you'll look in the airway for the obstruction. And here's your rationale. When a choking patient becomes unresponsive, they are likely in cardiac arrest due to the obstructed airway. The American Heart Association guidelines recommend starting CPR immediately. And of course, CPR begins with chest compressions. The chest compressions may help to dislodge the object by creating pressure in the airway, but then after your 30 compressions, when you're going to administer your 2 breaths So when you look at Mr. Tubus, instead you would look in the mouth. And if you can see the object, you can perform a finger sweep to remove it. If you don't see the object, you can go right back to your chest compressions. When the advanced responders come, they have different scopes. They have other objects that they can use so they can see further down into the airway. All right, let's go to our next question, team. Question 40. A nursing home resident has broken and jagged teeth, making it difficult for them to chew. As a CNA, which dietary modification is most appropriate for this patient? Is it A, a mechanical soft diet with small bite-sized pieces of food? B, parade diet to ensure food is soft and easy to consume? C, regular diet with extra fluids to help with swallowing? Or D, high fiber diet to promote digestion and prevent constipation? All right, and my study buddies and my scrubs and ambition are members. We thank you for being here. Keep putting those answers in the chat. I'm so proud of you all for studying on a Sunday evening. And for this one, yes, the answer is A, mechanical soft diet with small bite-sized pieces. And here's your rationale. A mechanical soft diet is the best choice for patients with broken or jagged teeth because it includes soft, easy to chew foods that require minimum effort to break down. This diet typically includes mashed, ground, or finely chopped foods like scrambled eggs, soft vegetables, and tender meats. All right, 10 more to go, you all. Great job. Question 41. What type of diet is recommended for a patient with peptic ulcer disease? Is it A, spicy and acidic foods? B, high caffeine foods? Is it C, high fat diet? Or is it D, bland, low acid diet? And I think you get the gist of it. Now, anytime it's related to the stomach, especially acidity, if someone has ulcers or reflux disease, they're getting the bland diet. So yes, the answer is D. Avoiding spicy and acidic foods reduces the stomach irritation. But you all are smart and you knew that. Moving right along, question 42. An elderly patient in a nursing home is at risk for muscle loss and slow wound healing. Which of the following foods is best for maintaining muscle mass and promoting tissue repair? Is it A, applesauce, B, chicken breast, C, white bread, or D, jelly? All right, so we want to prevent muscle loss and we want to improve wound healing. Absolutely, it is B. We're giving them something with some protein. So it's going to be chicken breast. A chicken breast is a lean source of protein, which is essential for muscle maintenance, wound healing, and immune function in elderly patients. Applesauce and jelly are mostly carbohydrates with little protein, and bread lacks the necessary protein content. Elderly patients should consume adequate protein to prevent muscle loss and delayed healing. Question 43. An elderly patient complains of frequent constipation. Which of the following foods would be best to help regulate their bowel movements? Look, as a CNA, you don't give medicines. As a CNA, you treat people with foods, with the fluids that you give them. So if someone has frequent constipation, what food would you recommend? Is it A, oatmeal, B, mashed potatoes, C, cheese, or D, white rice? All right, revealing the answer in 3, 2, and that's right. Some good old slow oats. You're going to give them A, oatmeal. Oatmeal is high in fiber, which promotes healthy digestion and prevents constipation, a common issue in elderly patients due to reduced mobility and medication side effects. White rice and mashed potatoes have a lower fiber content, and cheese can actually contribute to constipation. So encouraging fiber-rich foods like whole grains, fruits, and vegetables, and smoked meal helps to maintain regular bowel movements. Don't forget to give them water. You're giving them all these fruits and vegetables, and then on top of that, you add an oatmeal, but you're not giving them any water. The fiber helps bulk everything up, but then the water helps to flush it out. So they're going to need both. Let's go to our next question. Question 44. What is a major dietary concern for a patient undergoing chemotherapy? Is it A, high-fat diet, B, excessive sugar intake, C, increased appetite, or D, malnutrition and weight loss? And you're going to be such awesome caregivers. You're going to understand the needs of your patients. Look, everything can't be treated with a pill. Sometimes we have to treat it with diet and exercise and movement and just a calm and loving presence of a good caregiver like you CNAs. And so, yes, if someone is undergoing chemotherapy, then D, malnutrition and weight loss are concerns. They may have to be weighed daily, okay, and we have to monitor their intake. So chemotherapy can cause nausea and appetite loss, which can lead to malnutrition. Question 45. An elderly patient is dehydrated and needs a food that provides hydration and essential electrolytes. What are those? Let's see, some potassium, some magnesium. So which food is the best choice? Would be A, peaches, B, crackers, C, watermelon, or D, fried chicken? And I know none of those go together, but it's 6 o'clock and I haven't eaten that much. So, yeah, all of that just sounded wonderful right then, with the exception of the crackers. Great job, team. Great job. Yes, we're giving them C, watermelon. Watermelon is high in water content and provides natural electrolytes like potassium, which helps with hydration. Question 46. A nursing home resident with early signs of memory loss asks about foods that support brain health. Which of the following foods is best for cognitive function? We have A, salmon, B, baked potato, C, water, or D, meatloaf. You want to improve their cognitive function. That is right. It is A, salmon. So salmon is rich in omega-3 fatty acids, which support brain health, reduce inflammation, and may slow cognitive decline in elderly patients. Question 47. A patient with COPD, that's chronic obstructive pulmonary disease, may benefit from which of the following? Is it A, a high fiber, low protein diet? B, a low calorie diet? C, high fat diet? Or D, small, frequent, high protein meals? So think about someone who's having respiratory issues. If someone's having respiratory issues, it's going to be kind of uncomfortable for them to eat a whole bunch of food. So the answer is going to be D. They're going to need smaller meals because it helps reduce bloating. And then also the protein helps to support the muscle strength. Question 48. A pregnant woman needs more of which of the following? Is it A, fat intake, B, caffeine, C, folic acid and iron, or D, high glycemic foods? I know this one's tricky because even I wanted to choose one that would not have been the right answer. So what are you thinking, team? I know. You think they need, the extra card, so you want to choose D, but nope, nope, nope. The baby needs the baby needs folic acid and iron. So the answer is C. So those nutrients prevent birth defects and support fetal development. Yes, mom is going to increase her carbohydrate intake, but if she only increases her carbohydrate intake and she doesn't improve how much iron that she's eating or folic acid, well, then the baby may have complications. So it's going to be healthy foods and also iron and folic acid. Question 49 is a long one, so let me go ahead and remove myself from the screen. A CNA is preparing for their state exam and wants to eat a breakfast that will help them stay focused and energized. Which of the following is the best choice? A sugary donut and coffee, B, eggs, whole grain toast and a banana, C, a fast food breakfast sandwich and soda, or D, nothing, because skipping breakfast would be best to avoid feeling sluggish. And I know this is a joke because I know none of you all would do this. You wouldn't skip breakfast, or you wouldn't just go to work and only have a sugary donut and coffee. You'd never do that because you know that you need some protein to make it through the day. So the answer is going to be you need some eggs, you all. It's going to be B. So eggs, whole wheat toast, and a banana. Get those electrolytes in your system. Eating a balanced breakfast before an exam helps maintain energy levels, focus, and cognitive function throughout the test. Eggs provide the protein, which helps with sustained energy and mental alertness. Whole grain toast offers complex carbohydrates, which release energy slowly, preventing a crash. And then a banana contains those natural sugars and potassium, which support brain function and reduce stress. You all, we made it to question number 50. I'm so proud of you all for studying with me on a Sunday night. So, question number 50. A patient on a low sodium diet asks for extra salt packets. What should the CNA do first? A, give the patient the salt. B, ignore the request. C, explain that salt can increase blood pressure. Or D, notify the nurse. Now, when you're taking a state examination, I need for you to remember your scope of practice. When you're taking a state examination, you do not provide education. The nurse does. And so in this instance, explaining that salt can increase blood pressure would mean that you're stepping outside of your scope of practice. They just asked you for extra salt packets. The answer is yes or no, or let me talk to my nurse. And so you all, yes, I know this is tricky because I'm teaching you about all this dietary, but the way that this question is worded, I need for you to answer it correctly on your test. It's trying to see if you're going to step into the role of an LPN or RN, if you're going to start teaching, and the answer is absolutely no. So it is D, you're going to notify the nurse. So CNAs must follow the care plan. Giving extra salt could harm the patient, which we knew you weren't going to do that. But the nurse should address the dietary concerns and provide the adequate education. I am so proud of you. Give yourself applause. That is right. And so don't forget that caring CNAs become caring nurses, and you're doing this the right way. So many of you all are going CNA to nursing school, CNA to LPN, LPN to RN. Look, you don't have to go to school for years. You can just do it in increments. CNA first, make sure that's what you really want to do. Make sure that you want to take care of patients. And then from there, especially if you don't have the family support or you just have a lot of obligations. And then from there, you can go to LPN school. That's 1 year. And then from LPN to RN, they have a bridge program. That's another year. So either way, in 2 to 3 years, you're going to be an RN, but you took stops along the way. You made more money each year. And of course, most of your facilities have tuition reimbursement, so they can help you pay for your college education. And if you haven't done so already, don't forget to like, share, and subscribe. I'm going to hang around for a few more minutes to see if any of our members have questions. And of course, you all, as always, thank you all for watching. For our members, I'm going to be in the chat and I'll hang around for a few moments to see what questions I can answer for you. All right, everybody, I'll see you in the next video. Have a good night.